Hello, my name is Danielle Wall, candidate for a job with the Department of Health and Human Services in Carson City, Nevada. I have obtained my master's in public health at Capella University, and I believe I can be an asset to the department with my overall skills and experiences that you can see in my resume. I would think of myself as a collaborative slash democratic leader. Oftentimes, the first thought that comes to mind when most people think of a leader is one main person in charge or a dictator. However, a leader often relies on a team backing them to help them carry out their tasks at hand. As a collaborative leader, it's important to include others in the group because the decisions that the leader will make is impactful towards the whole team. When collaborating, you can see the bigger picture, solve issues in the workplace, and get a sense of projects as a whole when collaborating with teammates. I also believe I fit the description of a conceptual leader. A conceptual leader can think through their ideas and transform thoughts into action driven solutions. People see leaders with conceptual skills as a strategic leader because of their ability to strategize and often resolve potential situations within the workplace. In order to tackle any problem directly, I have to conceptualize it within my mind to have a better understanding of how the problem can be organized or dissolved. I believe this leadership style can be most effective in work environments so that the problem and solution can be resolved diversely from several different angles. I used to be an after school specialist at an elementary school for an after school program in my local district. After years of working in my role, I worked myself up to the top as a site manager, which means I would run the after school program and organize all the events and groups and manage a group of activity specialists who were divided up into different age groups to watch the children. Ultimately, when an event would occur between another student or a student became injured, as the site manager, I had to fill out the incident forms and had to tell the parents what happened to their child, which was not always a happy conversation. In turn, this is why I was very authoritative and controlling when it came to the children's overall health. However, I still valued my activity specialist opinion since they were the ones on the ground level working with the children daily while I was in the background. This is where my democratic leadership style played a part. The word democracy means run by the people. When implemented as a form of leadership, it means making room for multiple people to participate in the decision making process. Because I'm a collaborative leader, I value the people's opinions that I'm head over. When including others in decision making processes, maybe they can see a perspective that me as a leader cannot see. I have collaborated with various stakeholders, including the chief of police in Plano, when conducting a needs assessment in my community on the mental health in African Americans, a project that I headed over during my undergraduate. I have developed an outreach project for malnutrition children and partnered with the North Texas Food Bank. So, two systems I use to help strategize a plan to address a public health issue is the community action model and the analysis implementation cycle. So, the community action model is a 5 step community driven design to build communities and capacities to address health disparities through mobilization efforts. So, the goal is to provide communities with the framework to plan and implement and evaluate a health related action and policy. I also use the analysis implementation cycle. It is important. It is an important component of impact evaluation. The descripting findings of an implementation analysis can help contextualize the impact findings and generate hypotheses about why the program did or did not have a positive impact. I collaborate on both of these models to help me design a plan and analyze a way to solve it. So, A time when I needed to use negotiation tactics and mediation skills was actually within my own small community, aka my family. Oftentimes, when there's a disagreement, I'm often the mediator, the person who designs messaging to appeal to both groups of people. In this case, my mother and my sister. They do not get along. And my sister made a rash decision that my mother was not too happy about, which resulted in a fight. The outcome was helping each side to help understand each other's perspective, and it was a successful outcome. So, two huge issues that I believe plague public health organizations are: one, limiting and effective leadership, including poor interaction among technical, political aspects of decisions, rapid turnover of leaders, and inadequate relationships with medical professionals. And number two, the problem in relationships among several levels of government. This can severely impact our financial resources and ability to get grants and funding from said levels of government. So, overall, based on everything you heard, I believe I'm a qualified candidate because not only am I willing to do the work, I believe I have great work ethic and I have experience in the field and possess the qualities based on my educational background to connect with the community and to help build a better ground in the decision as a public health figure and behavioral health worker. What I do not know, I'm willing to learn and grow in the position to be the best to lead the division and collaborate with my team to create a safe space for all who joins us. I hope with all that said, I can show you I'm a great leader and I look forward to hearing from